Hi everyone, in today's video, we're going to explore everything you need to know about wisdom tooth extraction. What are wisdom teeth? First, let's understand what wisdom teeth are. Wisdom teeth, or third molars, are the last set of molars that usually emerge in your late teens or early 20s. While some people have enough room in their mouths for these teeth to come in properly, many of us don't, leading to potential issues. So why do wisdom teeth often need to be extracted? There are several reasons. Impacted wisdom teeth, which don't have enough room to emerge or develop normally, can lead to pain, infection, and damage to other teeth. Even if they come in correctly, they can still cause problems, such as crowding or difficulty cleaning. Procedure. First, the area around the tooth is numbed with local anesthesia. In some cases, sedation may be used. The surgeon will then make an incision in the gum tissue to expose the tooth and bone. The tooth may be divided into sections for easier removal. Once the tooth is out, the area is cleaned, and stitches may be placed to help with healing. Recovery from wisdom tooth extraction is a crucial part of the process. Rest is essential, so take it easy for the first few days. Apply ice packs to reduce swelling and follow your dentist's instructions for pain management. Stick to soft foods and avoid straws, as sucking can dislodge the blood clot and cause dry socket, a painful condition. Now, let's talk about what you can expect post-extraction. It is normal to experience some bleeding, swelling, and discomfort. These symptoms should gradually improve over a few days. If you notice severe pain, excessive bleeding, or signs of infection, contact your dentist immediately. That's all for today's video on wisdom tooth extraction. We hope you found this information helpful and reassuring.